nice to see you again. It's Hot Topic Tuesday. So today we're going to go over the do's and the don'ts for before injections, before surgery, and then also after. So what's one of your important do's before surgery?
I really do like imaging and wish pictures.
Oh yeah.
So especially for breast augmentation, lifts, etc. I want to understand the patient's goal. I want to know if you want to look natural or fake.
Yeah, because I feel that sometimes, for once, like some person may think, oh, those implants look, or that size is going to be more porn star or stripper size, where somebody else may think, they like that. So it's really what they want. I love the wish pics too, because sometimes a patient will come in and
is that one of your answers too?
Yes,
okay.
I love it. Yeah. Having a wish pic, for some patients come in, they want to have their cheeks done, but when I'm going over the contoured cheek or just bringing back the youthful cheek, sometimes people don't really understand that. So having your wish pic of, oh hey, I like this Kardashian high cheekbone, that's perfect. Another do before injections and surgery, stopping the aspirin blood thinner products 2 to 3 days before. That's a big one.
That's a big one. And that's kind of like in my second one is just review your instructions. It's a big day. You're nervous, you're excited, you're trying to get all your things organized at home, your kids and your husband or spouse. And we forget the simple thing is just kind of do a quick perusal. I know my nurses go over quick instructions of what to prepare. Things like stopping aspirin products, blood thinner.
I would just make a habit of keeping those pre-op notes beforehand so you can review them.
Put it by your bedside dresser or on your bathroom counter and just do a quick once over, like shaving certain areas, removing all piercings, just little stuff like that. I think it's real important as a patient to learn to ask for help. And so when you're preparing your surgery, just help in the areas. Make sure you have the first couple days someone around to help you, because you might feel under the weather first 24 hours. Help you with a ride to surgery and picking you up, because you'll be surprised. Some people can't find a ride, but now's the time to ask for help.
I know you guys all want to come in here with your makeup done, look beautiful, but we're gonna wash it all off. So I think it's really important before you come into your appointment to wash with a really good soap, cleanse the area. For injectables, if you want your makeup applied afterwards, you can always do it. Let's go to some of the don'ts. Don't.
Do not ask for help on the internet. The internet is evil, okay? And it's like news. Like when you open up news and it's like there's good news, 99% of it is bad news, fake news, wrong news, and I can't stress like how many times patients come in and they say, oh, I freaked myself out. I Googled and YouTube my surgery before surgery. Do not do that.
A big thing is, so this will be on back to the do list. If you have any questions, sorry. So if you have, I think it's really important just to write it down. Get a piece of paper if you have any notes.
Write your
call us.
down.
And
not too many.
Oh, we love it. We love the questions. So you can always call us or bring it in, and we can go over those questions for you. Don't search the internet.
Please don't search the internet. We're the internet. I'm your internet. She's your Google. But we're here to answer all your questions. There's a lot of false information.
Another don't. I'm not totally against my patients going to the gym right after. I mean, I know life gets crazy. It's good to just let your body heal after surgery and after injections, so then you don't cause any swelling and bruising more than what you had already had.
Oh, mine was the same. My number 2 is the same. Just don't be active too soon. Don't push your body. Listen to your body. Very easy. Breast augmentation, you can usually get back at 5 days, but don't kill yourself. Let your body heal. So don't be active too soon.
Right. Try to stay low sodium for the first 2 to 3 days after injectables, and low alcohol, because it will cause some bruising, some swelling. So try to keep that to a limit.
My final don't is do not expect your result to be good right away. And that happens too much. Again, it's a journey and it's a process. We generally tell people about 3 months for surgery results to look photo ready. So many times at a month, they're like, oh, is this the size? And it's not even close to being completely healed.
Right.
So don't jump to your result conclusions right away.
Okay guys, that was our top do's and don'ts. If you have any questions, just remember to write them down so we can go over them with you. See you later.